So how common is breast cancer in our country? So it is astonishing to know that 1 in 9 women are being diagnosed with breast cancer. And if you look at the latest statistics, breast cancer accounts for about 26% of all the cancers in the country, combined both male and females. So this is the reason awareness for breast cancer is important, because the incidence of breast cancer has surprisingly risen over the past decade. What are the risk factors for breast cancer? Well, there can be some modifiable risk factors and there can be some non-modifiable risk factors. So some of the modifiable risk factors are obesity, alcohol, cigarette consumption, reduced consumption of fresh fruits and vegetables. These are some of the modifiable risk factors for breast cancer, along with usage of oral contraceptive pills. There are certain unmodifiable risk factors such as genetic factors and family history of breast cancer. Roughly about 10 to 15% of breast cancer patients have a history of breast cancer in one of their family members, which is the reason we ask for genetic testing in selected group of women who are diagnosed with breast cancer. Now, apart from this, there are certain other risk factors for breast cancer, such as if a woman has started her menstrual cycle early in the age compared to her normal peers, she is at an increased risk of developing breast cancer. And if a woman has late menopause, which is late stoppage of her menstrual cycle, even she is at a risk of developing breast cancer. And women who do not have children, we call them as nulliparous women, or women who have not breastfed their children, they are at an increased risk of developing breast cancer compared to other women. Apart from this, girls who received radiation to their chest wall in their childhood for treatment of any other cancers, they are at an increased risk of developing breast cancer. Now, the symptoms depend on the disease extent, depends on the stage of the disease. So early breast cancer presents as a painless lump in the breast, which is progressive in nature, progressively increasing in size over a period of months. When the breast cancer becomes locally advanced, the patient can present with nipple discharge. They can have changes in the skin over their breast, such as redness or skin thickening. They can experience a lump in their armpit, which can be because of lymph nodal spread. If the cancer has spread to different body parts, then the symptoms will be differing accordingly, such as if the cancer has spread to the liver, they can have jaundice. If the cancer has spread to the bones, the patient can present with bone pains. And if the cancer has spread to the spine, patients can have back pain, etc., so on and so forth. These are the common presenting complaints of breast cancer.